Depression is one of the most frequently diagnosed mental health problems and has been ranked by the World Health Organization as the leading cause of physical and social disability in the world, surpassing HIV, malaria, and diabetes. Over 350 million people are affected by depression worldwide. It affects both children and adults and compromises immune function, thereby predisposing the bearer to other physical health problems. Unmanaged depression can also threaten social relationships, school and work performance, and your lifestyle. Important to note also is that it is linked to suicide, which is one of the leading causes of death worldwide. The good news is that depression is treatable and in many instances it is preventable. Here are my top 5 tips for dealing with depression. 1. If you notice significant changes in your mood, your ability to focus, eating and sleeping habits, talk to someone close to you, someone that you trust. Talking can help you to sort out your feelings, and it allows you to receive feedback on ways that your behaviors might have changed. If you're not comfortable talking to someone, try writing, journaling your thoughts and feelings, or using art as a method of emotional expression if you're into art. But the role of social support is essential when dealing with depression. So staying connected with your close friends and relatives will support your recovery efforts enormously. Number 2, try to stay active. Activities that used to bring you joy may seem uninteresting or difficult to engage in when you're depressed. But staying active, particularly exercising, is extremely important due to its neurological and psychological benefits. The endorphins that are released during pleasurable and high-impact activities help to counter depressive symptoms and promote feelings of happiness and well-being. Number 3. You should avoid unhealthy self-medicating behaviors such as poor diet choices, alcohol, and the use of illicit drugs. While these may appear to offer some form of comfort, they simply mask symptoms momentarily, but are addictive and actually make things worse in the long run. Drugs such as marijuana are linked to psychotic and other psychiatric illnesses, and alcohol misuse can lead to the disease of alcoholism and other work, social, and family problems. Number 4. If it is your child or a friend, a family member, someone else that you suspect to be depressed, talk to them about what you've noticed. Ask them how they've been feeling. Open conversations about depression reduce the fear of stigma and thus makes it easier for your loved ones to seek the help that they need. Ask them about any suicidal thoughts that they have been having. Talking about suicide is shown to reduce the likelihood that it will occur. If you don't feel able to cope with helping someone else with suicidal thoughts or depression, seek advice from a mental health professional about ways in which you can help them. My final piece of advice is my simplest piece of advice. Get the help that you need. That is, seeking out psychological treatment from a mental health professional. The thing is, life can be really tough sometimes, and certain situations, certain things that you experience may leave you feeling pessimistic, irritable a lot, unmotivated, and very unhappy. You may no longer be able to enjoy the things that you once enjoyed. It's not unusual to feel these feelings in times of adversity. It's natural and often protective in small amounts. But when these feelings become exaggerated or long-standing, they just won't go away over a long period of time. And they begin to severely affect your ability to function in your personal, social, and work life. This is an indication that it may be time to make an appointment to see a mental health professional, such as a psychiatrist or a psychologist. Getting help and getting help early can save your life, your time, your money, and your relationships. Taking the first step may feel really difficult, but depression is a chronic disorder and ignoring it will not make symptoms disappear. Mental health professionals operate in a confidential, non-judgmental, and caring manner and are trained to help you manage your symptoms and develop coping strategies to keep depression at bay so that you can live a healthy, happy, and productive life.